Bhagwan Sri Sathya Sai Baba has often said, "My life is my message." Indeed, it always has been so with every avatar. The unique thing about Baba's message is that it is finely tuned to the needs of this age. Selfless service with compassion to the poor and downtrodden has always been at the core of his teachings.
కేవలము ప్రేమ చేతనే సేవ చేయండి. బీదలకు ముఖ్యంగా సేవ చేయాలి. ఆ బీదల సేవనే మిమ్మల్ని సంరక్షించేది. రామసేవ అని కాదు, బీదల సేవనే రామసేవ. కనుకనే బీదల సేవ చేయండి. ఈ బీదల నిమిత్తమై మీ ప్రాణాన్ని అంకితం చేయండి. నాకు వేరొక ఆశనే లేదు. నాకు ఈ బీదల సేవనే ప్రధానమైన లక్ష్యము. ఏమైనా సరే ప్రాణాన్నైనా వారికి అర్పితం చేసి వాళ్ళని కాపాడటానికి ప్రయత్నం చేస్తాం. ఈ లక్ష్యం లోపల 1000 ఒక భాగాన్ని మీరు పెంచుకోండి. ఇది ఏ మానవుడు ఈనాడు చేయవలసినటువంటిది.
Baba has thus started numerous social welfare projects that serve those in need and shine as models for others to emulate. Even after this mind-boggling set of projects, Baba felt there was still something missing.
Way back in the middle of June 2005, Bhagwan was repeatedly telling devotees in the veranda when he used to come for darshan that even though we have started a hospital here, general hospital, a super specialty hospital, still many people in villages are unable to come to our hospitals. Is it possible for us to take the hospital itself to the village? And he added, can there be a bus in which we can have facility for X-rays, scan, blood tests, urine tests and all?
When such a bus did arrive, Baba called Dr. Narasimhan and said, "Here is a bus with good diagnostic equipment. Bring your doctor's team and deliver quality health care. Take it to the villages first as a service for the village and later transform it into service of the village. I will guide you all the way and give all the support you need."
Baba told me that నేను దీని పేరు సత్యసాయి మొబైల్ హాస్పిటల్ అని పెడుతున్నాను. ఇది క్యాంపు కాదు, క్లినిక్ కాదు.
Drawing from his long experience in rural medical program, Dr. Narasimhan formulated a few core objectives for the effectiveness of this service. They are regularity of service, availability of a strong medical team, diversity of expertise, basic diagnostic facilities for each department, a good pharmacy, and a viable backup. However, Baba gave a few more instructions that transformed this service into a most unique healthcare system.
మీరు అన్నీ చేయగలగాలి. యూ షుడ్ బి ఏబుల్ టు డూ ఎవ్రీథింగ్. పేషెంట్లను అటు ఇటు తిప్పొద్దు. కానీ మత్తు మంది ఇచ్చి చేసే ఆపరేషన్లు చేయకూడదు. ఈ సెట్ సర్జరీస్ విచ్ ఇన్వాల్వ్ గివింగ్ అనెస్థీషియా, జనరల్ అనెస్థీషియా, యూ షుడ్ నాట్ డూ. బాబా సెట్ మీరు చేయలేకపోయినా మీరు చేయించగలగాలి. That means even if you are not in a position to immediately do, don't wash off your hands. Don't say go to a so-called higher center. You should take responsibility and see that the logical solution is arrived.
India has always been a land of villages. Surrounding Puttaparthi, there are at least 1,000 villages within a circle of, say, 60 kilometers radius. Clearly, the proposed mobile hospital could not serve them all. 12 big villages belonging to 6 mandals around Puttaparthi were selected as nodal centers. These nodal centers are within 50 kilometers, making them well suited for a day's visit. Each center would serve people from that village and also its surrounding 50 villages. It was decided that the mobile hospital would go to these villages one by one on the first 12 days of every month. But where in the village would the treatment take place?
We have to base the mobile hospital at some place. For that, we need at least 5 rooms, because I knew that we had to create 5 divisions: Department of Medicine, Department of Surgery, Department of Obstetrics and Gynecology, Department of Ophthalmology, /Dentistry, and Department of Pediatrics. So I need at least 5 rooms, and which also have an open, sort of a place in front, courtyard like thing. So obviously in a village only the school is available.
So that is it. At every node, the local school would be used as the base of operations for the day.
Good morning, how are you? Sit down.
The mobile hospital has been serving the villagers for the last 10 years, treating more than 600 patients on any given day. Let us now spend a typical day with the mobile hospital and get a feel for how it is not merely an outreach program, but has penetrated deep into the villages. On the previous evening of the camp, a group of volunteers set up tents and medical equipment in the school premises. Then, along with a few doctors, they go into the village and inspire the villagers to adopt hygienic living. This is a very unique practice that brings the entire village together as one family. As the sun rises, the villagers are waiting eagerly and welcome the bus like an honored guest. The Siemens bus, aptly named Sanjeevani, is thus welcomed with devotional fervor and parked under a special tent. Baba had insisted right in the beginning that the bus should have a powerful electrical generator. This has become very vital for the entire setup, since the bus supplies electric power to all the departments which have sophisticated medical equipment. But for the bus which supplies stabilized power, it would have been almost impossible to have this setup in a village. Next, a morning brief. It consists of suggestions on nutrition, sanitation, and preventive health care. Since the main objective has been to offer holistic health care, the preventive aspects are given as much importance as the curative. The doctors learned from Baba that a spiritual way of life is more conducive to good health. Thus was formed an equilateral triangle of holistic health care, with its 3 aspects becoming the guiding principles for the mobile hospital service. After the morning brief, the patients are screened and escorted to various departments to get registered. As the patients start queuing up, the doctors get a briefing from Dr. Narasimhan.
This is again a very, very value-added service which we are having.
There are 15 to 20 doctors on any given day from a list of 350 who have volunteered to participate. Many of these doctors are specialists in their fields and come from all over Andhra Pradesh. Thus, when they meet the patients, they are able to easily communicate without any language barrier. Apart from the urge to serve, these doctors are particularly impressed by the discipline of the patients and also the speed with which a diagnostic test result comes through. That is made possible by the bus, which has a pathology lab for all types of blood analysis. An X-ray machine with an automatic processing unit that instantly gives the X-ray print. And an ultrasound scanner with a color Doppler facility used for a 2D echocardiogram of the heart and also for scanning other internal organs. Based on the diagnostic reports, the doctors prescribe appropriate medicines. The patient goes to the pharmacy, where he is administered enough medicines to last him a month. Some of the visiting doctors are amazed at the range of medical services these villagers are privileged to have, the kind of experts they get to meet, and all that in a single day. Apart from the high-tech treatment in the various departments, specialized diagnostic tests are set up from time to time and really push the limit to what can be done if one has the passion to serve. To handle the increasing number of diabetic cases, a new pathology lab has been set up. Cervical screening of women helps detect precancerous manifestations that could lead to uterine cancer if left undetected or neglected. The electroencephalogram test, also known as the EEG test, is done for patients with neurological problems. And last but not the least, the operation theatre is reserved for a few days in the Sri Sathya Sai General Hospital, and complicated surgeries for the villagers are done here. That truly and completely defines the word comprehensive, isn't it? Finally, at the end of the day, the entire setup is removed and the rooms are available for regular classes on the next day. Enthused by Dr. Narasimhan and team, many villagers come forward to help in various capacities. A group of 12 trained volunteers from the villages accompany the mobile hospital and serve in both setting up of logistics and functioning. With a little training, a barber sets his work aside for the 12 days, gets involved in setting up many departments, and actually operates machines like a trained hospital personnel. Like all Baba's institutions, workers of the mobile hospital maintain a low profile. And yet, at times, good work gets recognized from unexpected quarters. The Faculty of Clinical Medicine in faraway Cambridge University sent an intern, Stephen, who went along with the hospital team and presented a much appreciated report. In 2013, the CNBC TV channel announced that after surveying 3,000 hospitals in the country, the mobile hospital was one of the winners of the 12 awards contemplated.
You're watching CNBC TV 18.
Awarded for innovation in transforming lives, Sri Sathya Sai Mobile Hospital.
Yes, the mobile hospital has indeed transformed thousands of lives and is a benchmark for those seriously interested in serving the poor. The Sai avatar could be aptly described as pure love walking on 2 feet. Today, that same eternal love also moves on wheels, manifesting in the mobile hospital as loving healthcare.